Several national publications, including USA Today, have said that this area is now one of the worst places in the United States for catching the flu. We at BTN TV are taking an in-depth look at this dangerous outbreak. First, a basic question. What's the difference between a cold and the flu?
The cold is usually a viral particle that affects the upper respiratory tract. It kind of mostly limits itself to the head and neck area. Causes congestion, runny nose, cough, inflammation. The flu is also a virus, but it's kind of a very aggressive virus in the sense that, it causes upper respiratory complaints, but it's also very, very active in the lower respiratory tract as well. And so it's kind of, if you would, you just kind of compare it to a more aggressive version of the common cold.
Influenza is one of those diseases that has plagued humankind for about as long as humans have existed. And in doing so, it has killed millions and millions and millions of people. The worst outbreak in modern times was the 1918 Spanish flu pandemic. There were actually two outbreaks, the first being almost harmless, infecting many more birds than humans. But it evolved and changed enough that it was able to infect humans and spread rapidly from person to person. Because this type of influenza virus had never infected the human population before, it was able to infect an enormous number of people very quickly. Before it had ran its course, it is estimated that up to 40% of the world's population was infected with the virus, and between 20 and 50 million people died, and it killed off about 6.5% of the United States population. The flu virus's ability to mutate so quickly is the reason why it has been so deadly over the years.
Viral particles replicate 1 million times in the blink of an eye, so they can change. They can have a generation go through in no time. For us as human beings, it takes so long for a generation of a family to change.
This year, that ability to mutate has once again proven to be very hard for health officials to deal with.
You develop this vaccine for the upcoming year based on all the prior data that you have up until that point. And then when the virus hits, you see if you did good. This year, the data was showing that on the type B strain, we got it. The type B, we've covered it very well with the vaccine. Type A, not so much. Some of the numbers thrown out there by the CDC were about 40% covered on type A. Well, 40% coverage is leading to what we're seeing now. That's pretty bad. If you're missing 60%, this is what you see. In my opinion, in my experience, I've kind of seen this bad flu season thing happen about, on average, every 3 to 5 years. You see this shift happen where it causes you to miss. But really, it's not that you missed, it's the virus changed.
The flu is particularly dangerous to the people in two major high-risk groups, the very young and the very old.
Sometimes bad things happen just because you're tiny and you're a baby and your immune system isn't up to par because you're growing. And as you grow, you become more adept to fighting infection because you've seen more infection. So that makes sense. But also, I consider anatomy. A human being's larger. An adult fully grown is larger. A younger human being is smaller. So everything's smaller. Airway is smaller, everything's smaller. So it takes a lot less inflammation, congestion to block up a child than it would an adult. So if you put it in those terms, you can kind of see why you worry more about the little ones. Also shows why you worry more about the elderly. Because they're fully grown, they've lived a life and they've built up an immunity, but also as you get older, your immune system may be weaker, you may be suffering consequences of chronic diseases like COPD, emphysema, diabetes, or you might just be frail from the aging process. So you got to look for these populations that are susceptible and try to cover them a little bit more aggressively or pay more attention.
Now, you would think that an older person would be exposed to so many viruses in their life that they would have more immunity to the flu.
You functioned and your body deals with so many insults on a daily basis over the course of your life. It's the analogy that I use with patients where you say, have you ever seen a fine classic automobile? the things that these collectors keep around, as well built as they are, they just can't survive these insults over time and not be taken more care of. That classic automobile, if it gets a little bit of a rust ring, you better get on it. Otherwise it's going to eat away at the body. Or the leather in the car. If it's been there for 50 years, you better make sure you do everything possible every day to keep it soft and keep it, from cracking. It can't tolerate the heat and all the chemicals and environment that it goes through over the course of its life. So you got to do more, not less, to take care. Same thing goes for human beings. We are truly, truly built amazing. We can recuperate from so many things. You were younger, you hit your hand on a door or on the edge of a table or something, you heal up no problem, it's easy. Now you're older, your skin is a little thinner, you bump on something and it leaves this huge, horrible bruise that takes like a month to go away. What the heck happened? Once again, kind of analogous to the car story. You got to take more care. Prevention is the key. And so, yeah, aging does function as to how fast we can heal, recuperate, repair ourselves, how much reserve we have. I think we just got to respect the fact that it's a time function. We've dealt with a lot of beatings over the course of our lives, and our bodies served us very well, but at a certain point, these things just take a little bit longer for us to get over.
With an infectious disease, we have to be concerned with the spread of the flu. And large groups of people is an environment where it is very easy for a virus to move from one person to another. The most common of these types of crowds are in our schools.
Schools are very, very good and very cognizant of how infection spreads because they have a micro view of it. It's like they get to see it actually happen in front of their eyes where infection spreads.
There's been some talk about closing our schools until this blows over.
As of right now, there aren't any plans to close the schools. We have been communicating with Dr. May at the health department, and he says that the CDC does not recommend that the schools close right now. So there's really not much reason to close the schools as of right now because the students will still be going other places. They'll be going to the malls and things. So as of right now, there's no reason to close schools.
The school system is taking precautions.
We have sent letters home to parents that explain the symptoms of the flu, what to do, and encouraging them to keep them home if they are sick. We have other new signs put up in the bathrooms about hand washing. The teachers are encouraging students to wash their hands more frequently. They're trying to find things in their classrooms that students touch a lot, like keyboards, headsets, and trying to sanitize those in between the use of those.
You can teach your children a lot about personal hygiene that will protect them, but younger children, just by their nature, are harder to protect.
Kids are more likely to spread this stuff because if they're really, really young, you can't blame them for being snotty-nosed and wiping their nose and going and touching the door handle and everything else and giving a hug to people. And I mean, that's kids, and you can't even explain to them to do otherwise. So teachers are taking on the burden. I know when my kid was young, it was amazing what they were doing at that young age, even in daycare for children, as far as making them wash their hands when they got in the classroom in the morning, practicing that throughout the day. Every time they go to the restroom, they have to wash their hands. I mean, they ingrain this into your kids from an early, early age. So they're doing their part.
And that prevention is the key to protecting yourself and your family.
There are some time-proven things that can help. My patients often ask me, Doc, how is it that you're not sick? You see this stuff all day. And I work a lot. I mean, I'm every day in it. And fortunately, I haven't gotten it yet. But I do tell people, keep it simple. Some of the fancy stuff that we look at as medical developments that have come across in the past 50 to 100 years, developing antibiotics and doing all these things, that's great. They help us. But some of the oldest things developed are the most effective. Hand washing. It's an amazing thing. Amazing. Literally, that is all I do. I wash my hands before I see the patient. You may not see me do it in the room, but I've washed my hands before I walked in. So I wash my hands before I see you, I wash my hands after I see you, and I might wash them once in between. So simple things, hand washing, hand hygiene, it's one of the most effective public health measures ever developed. Another public health measure that has been come across in our history is quarantine. People get isolated when they had bad diseases and they were traveling across waters on ships and bringing diseases across. They were quarantining people. Well, we don't have to quarantine people for the flu, but we can do stuff for ourselves. So when my patients are asking me, how do I protect my baby from getting the same disease I have because I don't want the young one to get sick? Isolate all your trash. Every tissue you use goes into a separate bag. Same thing we do in medicine. You look in this procedure room and you have a separate bag for blood products. You have a separate area where needles go. We put all this stuff off to the side. We don't want to contaminate other things. So isolating all your trash to a separate area. If you have a separate room of the house that you want to sleep in and nobody else is in, that's a good idea. Hand hygiene, like I mentioned. Simple things. Coughing into your elbow instead of into your hands. Huge deal at preventing transmission of this stuff. As much as patients are in awe of the fact that some providers aren't getting sick, on the provider side of things, it's a whole lot different seeing you here than seeing you at home. Here, everybody's on their P's and Q's. They come in and they're like, no, doc, you don't want to shake my hand. I'm sick. I just coughed into my hand. Really? Are you like that at home? Because when you get into this medical setting, you're extra cautious. You're like, oh my gosh, using sanitizer, people are offering you masks and you're putting them on. You don't see people doing that stuff at home. At home, you're comfortable. You're in your own home. If you're coughing, you're coughing. You feel comfortable. But here, people come in and they're washing, sanitizing, not wanting to shake your hand. So I think from the patient part, they're doing their part for us. On the provider side, not to get infected. We are doing our part as we normally do, as we've been taught. It's been ingrained into our training to do these simple things to prevent infection spread. So let's take these things home.
We haven't talked about medication. In the 21st century, there have been some amazing advances in medicines that treat the flu.
And that's prophylaxis dosing of Tamiflu. So Tamiflu is an antiviral medication that we prescribe for flu patients. Mostly effective if taken within 48 hours of your symptom onset. Usually it's treatment dose, where you take one tablet twice a day, or if it's liquid, you take the liquid twice a day for 5 days. That's treatment dose. Prophylaxis dose is taking that same medication, same amount, except doing it once a day for 10 days. So whether you take your 10 pills in 5 days or 10 pills in 10 days, that's the only difference between prevention dose and treatment dose. So if you know that you have flu in the household and you want to protect healthy family members and maybe consider throwing in that additional measure of prophylaxis Tamiflu, call up your family doctor and tell them, I've been diagnosed with the flu. I have healthy family members at home. They're patients of yours as well, or they're patients of you and I'm a patient of my adult doctor and the pediatric doctor. And just explain to them your situation and the prophylaxis dosing, and if they feel like it's appropriate, they'll go ahead and prescribe that and call it into the pharmacy, and that's an additional measure that you can take.
Thanks for watching our special presentation on this outbreak. We have tried to cover as many aspects about influenza as we could. If you have further questions, the CDC has set up a page just for answering questions about the flu. Just go to www.cdc.gov/flu/takingcare.htm. Take care of yourself and your family. It's very important.